municipality. I have been invited to speak before in Davao, Iloilo, Bohol, Cebu, and even in Manila, and Subic, and Legazpi City. So Bindoy before were only learners. Now we are become teachers and advocates for social health insurance program. And most of those who have visited our place are now replicating this in their own individual municipalities. And because of this program, we have received several projects also. Peace and Equity Foundation have given us 150,000 to start the couple program, which was our, I would say, masterpiece when we graduated from Ateneo during the LHP. So, nakakuha kami ng funding of 150,000 pesos. We selected, the COU is for husband and wife, by the way. PO is for population. L is for livelihood and lifestyle. That's COU, POL. Alam nyo, nakaka-touch yung ibang mga tao when we went out to speak about family planning program. Kahit anong isipin ko, no, maliit pa ako, family planning, hanggang na-popcom na lang, hanggang etc. Wala pa rin nangyari sa population growth natin. Umakyat pa rin. And in fact, I made my own survey. Ang average families namin sa bundok is 6 to 7 children per family. Ang marami. Meron pang iba doon, 14. Oh, grabe. So when we went out and speak about family planning, I usually talk about natural method. Si doktora na sa artificial. Magagalit yung simbahan namin eh. So, there were couples who were saying, bakit ngayon lang kayo nag-explain dito? 6, 7 na yung anak namin. Dapat noon pa. So you see, kulang na pala pagkapacitate ng mga tao. You know why? Kung alam lang nila yung programa pala, yung family planning, the artificial or the natural method, siguro na-reduce yung spacing sana mas malayo. Much more, we also have some challenges in the last 3 years. By the way, the province has a new health insurance program. The new governor has his own program. So they call that the FINO, the Provincial Health Insurance of Negros Occidental. It's actually the same with PhilHealth, kaya lang hindi lang sila magkasundo. So, nawala yung counterpart ng province. So, medyo mabigat na rin on the coffers of the LGU. So, ang ginawa po namin ngayong taon, last December, ginawa namin prepaid yung household counterpart. Because in our experience in the last 1997 to 2002, medyo humina yung collection efficiency namin sa household counterpart. Medyo kumunti na lang yung nagbayad. Kasi alam nila, kami ang nagbayad in advance. They paid either in cash, in kind, or in services. Meron akong midwife doon, 100% ang collection efficiency. Alam mo, ang ginawa niya, tumatanggap siya ng manok, tumatanggap siya ng panggatong, firewood. At saka, kung hindi, yung asawa naglalaba sa kanya on weekend. See? Ang ginawa ko rin, meron naman akong projects for farm to market road. Doon ko pinasok yung iba. Pinatrabaho ko on ditching on the roads para yung salaries naman nila, pwede pa bayad ng insurance. At least may protection sila for the rest of the year. So, maniwala po kayo, I was able to collect 6,033 households in advance. Nagbayad na sila for next year, for 2010. I did not expect that to reach that high. Pero pag nakapasitate mo pala yung mga tao, alam nila yung importante ng program. Yung iba umiiyak pa nga eh. Dahil drop out na ng mga midwife. Dahil gusto talaga nilang hindi ma-drop out from the list. So, just matter of educating at saka siguro political will. Yun lang po. Salamat. Any questions? Ang yung hindi yung ayaw talaga mag-participate, hindi naman namin pinipilit. Kaya lang pag nagkasakit, pumupunta sa opisina yun eh. Kaya doon ko na naman kinakausap. Kaya lang, it's really a hard job starting all of this. Yung community-based natin, yung pag-iikot namin sa bundok, yung pinaka-importante. Yung second year, di ba first year, libre yun? Yung second year, in the renewal of their premium contributions, when we went out again for 45 pesos per month and 10 pesos per month year after, we have testimonies already of those who were hospitalized. So those who were hospitalized, we have records of that. We will be asking them to share their experience also of the program. Kaya naman, marami naman na-persuade to continue with the program. So, yung iba, wala tayong magawa pag hindi talaga nagbayad, ma'am. Nila-drop out lang po namin yun. Although, yung na-drop out, pag nakasakit, babalik po yun. Nagre-enroll ulit po yun. Totoo yan. So, hindi naman pwede dole out lahat eh. Sabi ko, in my almost 21 years in public service, wala ko mas sustainable na program pag dole out. Because they don't feel a part of the program. But once they have part of the share of the program, and being a part of it, they wanted to sustain the program. Dahil alam nila maganda yung program. Yun lang po. Yes, pa. Kasi ang na-enroll po namin is families po eh. So, out of 8,000 families, 6,033 ang enrolled ngayon. 6,033, yes. Oh, by the way, we were a recipient of the 4Ps. Alam mo yung 4Ps sa DSWD, yung Patawid Pamilya Pilipino program. For every family who have, if the mother is pregnant or have a child, qualified na siya to receive 500 pesos for health every month. And for every child that is aging from 6 to 14 years old, will receive an additional 300 pesos every month. If you have a maximum only of 3 children, so that's an additional 900 pesos. So, we ride on also on this, na try to persuade also these 4Ps beneficiaries na magbayad naman kayo for the 200. Dahil sayang naman yung binigay sa gobyerno. Tapos magkasakit kayo, hospitalize kayo, maubos na sa hospital bills. Because these are supposed to uplift the people from poverty. So, sana makatawid naman kayo sa kahirapan, yung sinasabi ko sa kanila. At saka maganda namang effect ng program. Eh. We have a very high enrollment. During the implementation review that we had last Tuesday by Doc, maganda naman yung consultations namin on the pregnant women. Although, mahina pa yung 4 visitations. Dahil yung iba, kung kailan lumaki na yung tiyan, saka napapaprenatal. Nahiya sila sa first 2-3 months eh. First semester eh. First quarter. Yun ang nangyari. Pero, we're not giving up. Alam mo, although we can start with our own little way, pero kung nobody will start on this program on health, wala mayayari. So somebody has to start this and somebody have to teach them na talagang health is not our primary concern but their responsibility. So they have to change that behavior. Otherwise, lagi silang dependent sa atin. Wala mayayari sa program sa health. Kahit ano gawin natin, hindi natin kaya lahat. Yan lang po. Hindi naman po lahat. Yung mga catastrophic naman, na tinatawag nilang catastrophic doc na mga surgeries, meron namang coverage pero hindi man nabayaran lahat. Sa gamot namin, sa mental health center, meron kaming initial dose na good for 2 to 3 days. Yes, they will have to buy for the rest of the year. Yes, ma'am.